Welcome, Dr. Satish. How are you?
Hi, Poonam.
Hi. Thank you so much for taking out the time to speak to us today.
That's all right. Thank you. I'm sorry I got a bit delayed as I came back from a shift, but it's a pleasure to join you on the show. It's quite heart-wrenching to listen to the story of the couple or the two people who just spoke.
Yeah.
Yes, I'm here to answer your questions, whatever you got.
Yeah. So, Doctor, I really want to know, first of all, that, I mean, since as a doctor, a consultant who works in the A&E department, you must have seen and dealt with a lot of cases when COVID was really active in the UK. What was it like, and was it as bad as what the situation is in India right now?
I mean, I've worked both during the first peak and the second peak in UK. I haven't worked in India uh, during the COVID state. Yes, things were bad, especially during the second peak here in UK because the case number was just too many or too much for us to deal with. Even in a first world country like United Kingdom, we were struggling to treat so many patients. And yes, unfortunately, we lost a lot of young and old patients. Yes, it's of the 14 years experience that I've had, this COVID pandemic or the second peak of this pandemic has been the most difficult tenure of my professional life.
But doctor, tell me something. Were your hospitals prepared for this kind of this kind of situation? Okay, when COVID came first, it was new to everyone. But when the second wave came, how prepared were your hospitals, and how prepared was the system here? Was there enough oxygen? Were there enough medical supplies to treat the patients?
Preparation as such, yes, on paper, it's a first world country, so uh, resources were there. But then, because the demands went up so much and so quickly, we couldn't cater it to all these patients. So yes, the first few weeks it was really difficult with healthcare professionals, the number of people to help the patients, and we didn't have that bigger hospitals to get these many patients in. And as
Yeah.
far as oxygen is concerned, we had enough oxygen, but we couldn't give at a high flow rate because the way it works is it's not the actual amount of oxygen that goes down, it is the pressure at which it needs to be given that becomes a problem. Yes, so for a couple of days we did have problems with oxygen delivery here in our hospital as well.
But no one died gasping for oxygen, did they?
Now, I mean, I worked most of the pandemic. I did not come across a single patient who died because of lack of oxygen.
And no one died on the streets waiting because they didn't get a bed in the hospital.
A lot of patients died. A lot of patients died at home, care homes, nursing homes. The elderly ones were the first to die, especially during the first wave. And a lot of young patients died during the second wave as well. The reason for their death is multifactorial. But if you're asking me if they died because of a lack of bed or lack of resources, it's difficult to tell. I mean, yes, probably a little number, or compared to what's happening in India, a very little proportion of people died because of lack of resources.
Oxygen seems to be the most widely used word in India at the moment. Can you please
Yes.
explain what exactly it means when people send message saying my relative's oxygen is running low? How does COVID-19 do this? I mean, rob people of oxygen.
COVID-19 is, even though we've had coronaviruses before, be it in China or Middle East or even in India, you would have heard of Spanish flu or the swine flu or the MERS. These are all coronaviruses. So we've known coronavirus for quite some time now. COVID-19 is just a variant of it. Initially, we thought COVID-19 virus was a respiratory virus in the sense it would affect only the respiratory system. Now it affects every single organ of the body. We know that quite well. So
Wow.
You're coming back to your question of how does COVID virus rob the oxygen of a human body? It mainly enters into the lung. It's a respiratory virus, so it's there in the air. So anyone who breathes in through the nose or the mouth will get the virus in, and it enters the lung first. That's the port of entry. Like if you go to India and if you go to Delhi, that's the port of entry to the country. So the virus enters through the lungs, destroys the lungs, and usually what is an elastic lung compresses. So there is no gas exchange that happens, and that's how the oxygen level comes down.
I see. So, I mean, when you were dealing with COVID-19 patients in the UK, did you come across a situation where people needed lot of O2 concentrators, which has become a very, very popular and the most sold, medical equipment in this whole world? Were as many O2 concentrators used here in the UK as well?
I mean, oxygen concentrators were used in UK, but not. It was not as hyped as it is being hyped in India. Let me break it down. I mean, how do I say this? Oxygen concentrator concentrates oxygen. If you look around you in the atmosphere or in the breathing air, there is 79% nitrogen and 21% oxygen. Or if you say 8 parts of nitrogen and 2 parts of oxygen. So
Yeah.
this machine takes out the nitrogen, filters out the nitrogen, and gives you more oxygen. Okay, and that's how a oxygen concentrator works. We used to give it to patients who were being sent home after the first few days of treatment with other equipments as well. It was not just oxygen concentrator. You need, if you're starting a machine on a patient, you need a monitoring equipment as well to see if it is working right. So we used to send them home with a probe that would go on a finger called a pulse oximeter to measure the oxygen levels. And we would say for you, the target would be 94 or 92. It varied between different patients. So these patients used to go home with oxygen concentrators and measure the oxygen at home and call us back if the saturation or the oxygen levels fell down.
So basically, in India right now, people are just treating their loved ones at home, just simply buying oxygen O2 concentrators without having any knowledge of it. Because as far as I am aware, you can't even buy an O2 concentrator in the UK without prescription. Is that correct, doctor?
You're absolutely right. Oxygen concentrator, like any other medical equipment, has to be used under strict medical supervision. Yes, it, a doctor can prescribe it and a patient can use it by himself at home, but there are strict guidelines on what kind of machines for them to take home and what are the parameters that they need to look out for the machine to work. Oxygen concentrator just plays probably one third or half of the role. The medications and the monitoring plays the remaining 75% of the role.
See, that's exactly why I invited you to the show today, doctor. And thank you so much for telling us such valuable things about O2 concentrators, because in India right now these are being sold so widely. There is no prescription needed, and there are all sorts that are out in the market, from 3 liters to 5 liters to 10 liters, and now people are demanding as many high what do you call capacity O2 concentrators as they possibly can get their hands on. So please, could you just tell us, like, what can how helpful can these O2 concentrators be, and also um, uh, what can be the side effect if they are not used correctly? How to use it properly? First of all, how would one know how to use it properly?
An oxygen concentrator is a simple machine. If you buy a basic, I mean, if you get prescribed by a doctor and if you buy a basic oxygen concentrator on Amazon, it has few parts. A machine that concentrates oxygen, as I told you, it takes away the nitrogen and gives you oxygen. And that goes to a tube and then at the other end you have a mask that you put on your face. So these are the three basic parts of an oxygen concentrator. You might have a fourth one in sophisticated machines where you can vary the concentration of the oxygen that goes through the mask. So this is what a oxygen concentrator looks like. It is helpful, but it has to be prescribed by doctors. A person can't just buy it on Amazon and then put it on a patient who's got COVID symptoms without any kind of medical supervision or monitoring.
Because people right now, the way they are using it in India, including the oxygen cylinders, when they can't find a doctor or a hospital bed, and when they see that their loved ones oxygen levels are dropping, that's the first thing they are going out for. Are these really life saving equipments which can really help a COVID 19, what do you call, patient recover completely? But
Uh,
just like a lot of people think, they can just, as long as they have the O2 concentrator, they can treat it at home.
I mean, how I wish it was as simple as that. That way we wouldn't need any ventilators or NIV machines or any doctors. That would have saved like 90% of the lives all over the world. Oxygen concentrator doesn't play a big role. Yes, it can be started on someone if you're in a dire need of medical help. If you're in a remote place and if you're driving down to the hospital and if that's your last resort, yes, put the patient on oxygen concentrator. But then it is not just the amount of oxygen that dictates the recovery or the treatment of the patient. If you look at a ventilator screen, there are multiple variables on the screen telling the pressure support or the end expiratory pressure or how much of pressure at which we are giving the oxygen. So, to put into simple words, it is not just a lack of oxygen in the lungs that's the problem. It is the oxygen is not opening up the airway. So, in COVID, what happens is normal airway, if it is opened up like a pipe like this, the
Yeah.
infection causes it to compress. If you give oxygen through a closed pipe, it won't go anywhere. You have to give it with pressure, and a concentrator can't do that. There's no point in giving oxygen to a closed pipe. It has to be given at a certain amount of pressure. And these are complex physics which takes years to master. Okay. And when you give it over pressure is when the airway starts opening up slowly, over a period of long time, and it takes as long as 7 to 10 days for the airways to open. So a simple oxygen concentrator would not save a patient from COVID infection. Yes, if you're in a remote area, if you're driving to a hospital, if you're waiting for the doctor to come or for the ambulance to come, yes, meanwhile, if that's your only machine, put it on. But do not leave patients at home on that for long. They would die.
Yeah, I wanted to ask you that, like, what is the side effect of using these concentrators for longer periods of time? Because people are just leaving their loved ones for, for up to 10 days, 15 days on these concentrators. And yeah, even after that, people are dying. So yeah,
Oxygen, as we all know, is good for the body. But there are certain patients for whom too much of oxygen would be harmful. Someone
yeah.
who's a smoker who smoked all their life can't take too much of oxygen. You give them too much of oxygen, they become drowsy and they stop breathing. So, in such patients, you will kill them by giving oxygen. Okay, that is one. Second, you might be falsely assured that because you've got a concentrator at home, that the COVID virus is going to go away. Oxygen, as I said, is just a part of the treatment. It is not the full treatment for the infection.
So a lot of confusion among people about which concentrator is better. I mean, now that they are so widely available in India, there is no regulation put in place. So obviously people have bought these, but the ones who had 5 liter ones are now desperately looking for 10-liter ones, because apparently there is a rumor that unless it has higher capacity, higher concentration level, only then a COVID patient, it will be helpful to a COVID patient. I mean, does a 5-liter concentrator gives lesser concentration of oxygen as compared to the 10-liter, and is it even true?
So, as I said, there's 20% of oxygen in the atmosphere. Every liter of oxygen you give, the concentration goes up by 4%. So, you give 1 liter oxygen, it becomes 20 plus 4, that's 24%. And if you calculate it for 10 liters, that's 10 times 4, 40 plus 20, 60%. It's not a linear equation. The equation doesn't go straight because in the mass, there's a lot of leakage. So, you don't get the exact amount of concentration. These concentrators are prescribed by doctors looking at the condition of the patient. If their oxygen levels is around 88, 92, probably they might get away with just 1 liter of oxygen. Again, it is not a single parameter for a doctor like me, which dictates how much oxygen you need. They'll also see other things like how fast they're breathing, what's their heart rate is, what's their underlying lung condition is. So oxygen concentrators are best used for someone who's going home after a week or a 10-day treatment with a lower amount of oxygen. So do not buy oxygen concentrators by yourself. Let your doctor prescribe you according to your physical need.
Unfortunately, doctor, that hasn't been the case in India. Like I said, millions of people have already purchased and have already been using them at home. Not just oxygen concentrators, but they are actually giving oxygen through the oxygen cylinders to their,
I know,
to the people who are
I
sick
know,
at home. So
and
I'm but then what would a person do in desperation, if they can't, if they are not getting any help at all, they will try to get whatever is available to them. And that this is the news that's spread, that oh, these oxygen cylinders, oh, these O2 concentrators can help save your COVID affected loved ones. So people are just going for them. But now I just wanted to know that, when is there a way that people can look out for COVID-19 signs earlier, so that they and take precautions or take measures that they don't reach to a level that they have to take, these medical profession into their own hands and start treating the people at home?
yep, you've asked a very important question because in India now treatment seems to be killing a lot of patients. The first rule that you learn in the medical college is do no harm. If you can't help, please don't harm. So, going back to your question of how does COVID-19 present or what are the symptoms that you need to watch out for? To put it in a nutshell, there are two phases of the infection. The first phase is what the virus does to the body. Once we inhale, once we come in contact with a COVID patient, once the virus enters the human body through the lungs, now it is time for the virus to affect the body. That time you'll have temperature, I mean, that is high temperature, loss of taste, loss of smell, body pain, and bit of cough, and it lasts for 7, 8, 9 days. This phase is absolutely fine. No one dies in this phase. You don't
Okay.
need anything. All you need is, you know, your own home remedies like paracetamol, a bit of soup, hydration, good sleep, and isolation, and probably Netflix at the night. The second part, which is what kills, is what the body does to the virus, or in medical terms, we call it the immune response. In the sense, the body thinks that this virus is a big enemy and starts mounting a unnaturally high immune response. If you study the virus, you'll know that this virus is a very weak virus. It can't survive in the air for long. It needs a human body to survive. That's how weak it is. The reason it's killing people is because our body is mounting a very unnatural human response. So the symptoms that start after 8th or 9th day or the 10th day, where they have difficulty in breathing, this is where we're losing patients. This is where thousands and thousands of patients are dying. Okay, the second phase of infection. It is
I
difficult to pick up clinically, even when they come to hospital to see who's going to die or who's going to deteriorate. It's only recently during the second peak in UK that we recognized that there's subtle signs like when you walk 40 steps. It's a recognized WHO test. It's called a 40-step test. During the second phase, starting from any day after 7, from the time you started with temperature, you walk for 40 steps and feel short of breath. That is a sign that the immune response
Walk
is kicking
40
in.
steps.
Yeah. Second one, when you sitting by yourself, when you relaxing, when you've sat down for 40 minutes, 45 minutes, your heart rate, your blood pressure should settle down. You shouldn't have a high heart rate, or what we call as a resting high heart rate is an early sign that you're likely to deteriorate.
I see.
So
I
this is
see.
when you need to go to a doctor. When you're struggling to breathe, you're struggling to talk, you got pain in the chest on walking. These are the early signs. You go to the doctor, and the doctor examines you, asks you a set of questions. There are two main killers in this virus. One is high BMI or obese people, someone who's got a excessive body weight, and second one is diabetes. 80% of people who've died in this second phase or all over the world with COVID have died because of these two reasons. It has become like, because these two conditions are a curse to humankind and it's self-inflicted. And the reason a lot of people are in India are dying is because, especially in cities, we are either obese or diabetic. Okay. And they'll ask, yeah, so the doctor will ask you questions and find out if you've got risk factors and do a set of blood tests to see how bad a immune response is your body mounting. If it is bad, then they'll admit you for treatment. Only if you're requiring oxygen is when you need treatment. If you don't need oxygen, if you're not oxygen dependent, as we say in medical terms, you don't need treatment.
I see.
Treatment is what's killing a lot of patients in India. Do not go to hospital if you're not in post 7 days of infection, and do not go to hospital if you don't need oxygen. And how would you know you need oxygen? Is by doing this test. Walk up and down. If you can count it, count it. Otherwise, just go up and down a flight of stairs. And if you're struggling to breathe, if you're needing oxygen, is when you'll need to go to hospital. Stop using dexamethasone, remdesivir, all these antibiotics, ivermectins, in oxygen cylinders at home if you do not have these symptoms. The treatment is killing patients. These are strong medications. These are metabolized in liver and kidney. They affect the patient. When the time the patient comes to us in India, when I speak to my friends back home in India, they come with a very minimal infection, but their liver and kidneys are already you know injured or died because they've taken so many medications. That I hear things like primary pack even when they're not symptomatic. So please do not go to hospital if you do not have difficulty in breathing or if you don't need oxygen. And how would you know you need oxygen? Walk up and down. If you're struggling to breathe, if you're struggling to talk, it's only then you need to go to a hospital.
I am so grateful to you for, giving this information here on this show, doctor, because from what I'm hearing in India, I'm not a medical professional, but the way people are looking for these injections like remdesivir, we had never even heard of these medicines or injections, whatever these are. You just said it's an antibiotic, and people are thinking that these are some kind of a ramban or some kind of an amrit that they are going to inject into themselves, and that they are just going to be okay and they will be COVID free. There is so much misinformation
I'm glad you
going
brought this up
out.
because remdesivir is not a life-saving drug. Remdesivir is only indicated in moderate infection, and we use clinical parameters to decide whether it's mild, moderate, or severe. People now in India are buying remdesivir in black market for 40,000 a vial or 50,000 a vial. Please stop buying it. Remdesivir would not save anyone's life. Remdesivir alone has no role in treatment of COVID patients. kindly do not give money in black market and buy remdesivir. Remdesivir again is a severely hepatotoxic, in the sense a liver toxic drug. If you take remdesivir unnecessarily, you would be affecting both your liver and kidneys. Kindly do not give remdesivir unsupervised. In fact, during the second wave peak here in UK, we had stopped using remdesivir.
Yeah, that's what another doctor friend of mine told me. So I've even forgotten what I was going to just ask you. So, doctor, the amount of concentrators that are now becoming available in India, you know, and selling in the black market, and people wanting to just grab one for themselves, no matter what the price, is basically just. Do you think it's a waste, or is it good to have like a concentrator at home?
I mean, it's nice to see a lot of people in England and all over the world pooling in money and sending it to India. The other
Yeah.
day I was seeing that there were a couple of organizations sending 1,000 concentrators to India. It's not reaching the right people. It's a medical equipment. It's of no use, or in fact, it might cause harm, or it might falsely assure people if it falls into wrong hands or if it's not used properly. Yes, all your hard-earned money. Yes, the thought is good that you want to help people. Go through the right channels. Ask a doctor if there is a patient that requires it. Only then it should be given. Please do not send it to your relatives and your friends and tell them, if you get COVID, put this on. It's of no use.
I mean, we are also waiting for a delivery of 10-liter O2 concentrators, which we were told are going to be very helpful and must be sent to India. And after I read these reports, where I read, every uh, relief, what do you call, package that is reaching India is not really reaching anywhere. It's just ending up in the black market.
Yes.
And so that's the reason, Dr. Sab, I have decided to kind of go to India and make sure that the money that we are raising is used, for people and for stuff that they really need. And on that note, I have to mention that you have decided to go to India, and
Yes.
for up to 2.5 months, to basically volunteer at a hospital in Bangalore. So tell us about that. Why did this thought come to you? When everybody is advising their loved ones to stay at home and shield yourself and don't even think about coming anywhere near India. Not just you, but even your wife, she was like, why not? He has to go. It's our city. This is our time to like do something. I was so impressed. I wish my family members here could say the same way like your wife did. But tell me a little bit about what hit you about going rather than sending just help like others.
I mean, it was a spontaneous decision, to be honest. I was talking to my friends and family, and as any other Indian who's in UK, I mean, you're on the phone every day talking to your friends and family, trying to provide whatever help you can. And spontaneously, it came to my mind that things have settled down here. Uh, and let me find an opportunity to go work there, and see whatever little change I can bring in there. And more importantly, thanks to you for getting me the visa in less than 12 hours to go to India. I mean, yeah, I needed an emergency employment visa to go to India, and thanks to Poonam Joshi for getting me directly from the Deputy High Commissioner. Thank you, Poonam. I'm really grateful to
It's
you.
our lovely Deputy High Commissioner who even answers my messages, or I'm sure every other community member's messages, even past midnight. So salute to him, hats off to him, and the entire team of the High Commission of India. Whenever I have reached out to them for any kind of help, I have never been let down. Doctor, you are obviously going to India to you will be working in a hospital, right?
Yes, I'll be working in a 1,700 bed hospital called St. John's. It's a charity hospital. I worked in St. John's Hospital. Before I came here, I worked there for 4 years before I came here. I've been in the UK for 10 years now. Uh, so that's where I'll be initially going. But there are a lot of organizations that's approached me to find out if I can offer help. So I've kept an open mind. I'll be going to whatever place that I can to help in whatever way when possible. But I'll be based initially in St. John's Hospital, working in the COVID emergency and the COVID ICU.
Our salute to you for making such a brave decision, and that gives me more strength, and I am even more firm about the decision of going to India. I'm not a medical professional, but I cringe watching from here, feeling helpless that why am I not there. And I know one person can't make a huge difference, but whatever little, people like you, me can make. And I think government should kind of make a provision for people like you and me who are passionate about giving something back to our country, want to be there and to be of any kind of help to our country. They should kind of make a green channel so that we can just come with appropriate tests and everything and just straight away get on with our purpose. And that's something I'm going to start campaigning about, from today. I was just thinking about it, that why haven't people even thought about this, and why isn't the government kind of making it easy for people like us who want to come and give something. I think I'll just wait for like a week, because I've just had my second dose of vaccines. So I was advised to kind of wait for a little while before I go. Do you think people like you and me who are maybe thinking of going to India, any special precautions they can take, or any special equipment they can take with them to kind of protect from catching COVID?
I mean, the biggest part of COVID treatment is not to get it.
Yeah.
There's very little you can do once the infection is severe, especially if you've got risk factors like obesity and diabetes. You'll have to just watch them die. So, anyone who's got risk factors, please do not come out, do not come in contact with anyone, not just going to India, even here, until the pandemic settles. If you plan to go to India, speak to one of your doctor friends. They'll assess your risk factors. Make sure you have both your vaccines, not just one. And it's only after 2 weeks or 10 days after the second dose is when your protection is up to 60 to 80%, depending upon what vaccine you're taking. Okay.
Is that correct, doctor? That if you have had both your jabs, then you are at a lower risk of at least dying from COVID, or becoming very very serious, where you may need like a ventilator or something if you have no underlying conditions.
You're absolutely right. If there's one thing, or I mean, I can say two things that the vaccination does is it prevents hospitalization and it prevents deaths. During the second wave, when the vaccination started here, it was quite rampantly done. The reason we are all sitting at home and even thinking of going to India or having our loved ones around us is because of the vaccination. During the
Yeah.
second wave, once the vaccination happened, and as we were seeing above 80s, above 70s being vaccinated, even after the first dose, all of a sudden we saw they're not dying anymore. They're not requiring
Mhm.
that higher concentration of oxygen. So this is time tested. So if anyone has any doubt, any ounce of doubt of taking vaccine, please take it out of your mind. And whatever you're hearing on media, like clot or the complications of the vaccine, is very, very minimal. It is
Mm.
4 in a million. There's
Yeah.
high chance of you being hit by a car or die of a lightning than getting that clot. You'll die of COVID 100% if you get it, if you got risk factors. 100% is much, much more than the risk that or the problems you're going to get because of the vaccine.
So you think that people in India, if they had been vaccinated sooner enough, uh, and so even after this wave, there wouldn't have been that many deaths, or at least the need of oxygen to the extent that is being needed right now?
You're right again. Yes, India was the largest producer of serum. India is still the largest producer of vaccine, and it's a shame that we're losing so many people in our country. We exported vaccine to other countries. UK got its vaccine from India. When India, all of 1 or 2 days, when it said it can't ship vaccines to UK, all of a sudden the vaccination stopped here. And right now, to see India crumble like the way it is doing, it only says that we've got the resources. It's not the lack of resources. It is the way it is being
Priority.
channelized. Yeah.
It's the priority. India's priority was not to produce vaccines for their own citizens. Its priority was to produce vaccines that they could export to other countries, or to have their names on headlines that, oh, we have sent friendship vaccines to 61 million of them to so many different countries. Because if it was the priority, then all the citizens of India would have been vaccinated by now. And
Yeah.
it breaks my heart.
Yes. I mean, less than 10% of the Indian population is vaccinated as of now. Less than 10%. So the death rates is only going to go higher and higher. There's no second, there's no third peak. People talk about peaks. India is like 100 Englands. There is no peaks in India. Okay. The death rate's going to only go up. So if you have any, I know you got a huge follower thing. If you want to spread one message, I just have one request to you. Tell this to your loved ones. Put it out on your Facebook. If there's one thing that's going to save our country is vaccine. Please go out, get your vaccine. Yes, it is difficult. It is. You'll have to make phone calls. You'll have to call up a lot of people, or go probably drive down half an hour to get a vaccine. It's worth it. It's either death or vaccine. Choose vaccine, not death.
People also have this misconception that, that after a while it subsides, and then another wave comes. But I am thinking that another wave will come only when India will come out of this wave. India's population is so large that I don't know how long India it will take India to come out of this wave alone.
Yes, you're absolutely right. Yeah, I mean, everyone wants this wave to go away, including me and you, because it's taken away too many lives. But looking at the way things are going, and looking at the way people are being hesitant in taking vaccines, I don't see this wave going away any sooner. The only thing that's going to change the direction of this wave is having a vaccine.
I
No
think people
remdesivir,
are. Hmm,
no
please go.
remdesivir, no oxygen concentrator, no ventilators, no hospitals, no money is going to save you. If at all, if there's one thing that's going to save you, is 2 doses of vaccine, and please take it.
That's amazing. Just last question before you go, doctor. What made this virus so deadly that it is kind of people are falling like leaves in India, and within a matter of hours, a person who was talking, who could walk, who could, eat, is suddenly no more.
Yeah,
They just.
it's a very complex pathophysiology. Even for the scientists or the best physicians, if you ask them to explain the pathophysiology of how the way this virus works, they won't be able to do it. There's a concept called happy hypoxemia that we talk about. What does it mean? Happy hypoxemia in this sense, the patient would have low oxygen levels in the cell, not while checked on the body. In the cell, there'll be low oxygen, but outside you wouldn't have any symptoms. It is like a very sick patient inside the body, but outside you can't pick up any symptoms. So it's a huge challenge for the medical fraternity to find out the inner pathophysiology. So lots of research are still going on. We are still in a very early stage of understanding this virus. Probably it's a nature's way of getting back to us, probably to reduce the human population or something, because this is not going to go anywhere. If not India now, it's going to another country where vaccination is not done, or social isolation or social distancing is not followed. It is
And
not
might
going anywhere
mutate
in this
even
world.
more, and might
Oh yeah.
mutate into a much more deadlier one.
Oh yeah, this virus is very, very smart. It is evolving as we speak. The
Yeah.
virus that was in Wuhan was completely different to the one that was in UK, and the one in India is again completely different. It seems to be learning from what we're doing to the virus, depending upon the
Yeah.
treatment that we're giving and the vaccine that we producing. It seems to be evolving to a different virus every day.
What happens to the children? Sorry, it's, I promise it's my last question. So we are not vaccinating children, Dr. Sam. So what eventually will happen to them? Because I have been reading that there are many young people and even older people who uh, uh, who are carrying COVID, but absolutely have no symptoms. They don't even fall sick, but obviously they very quickly transmit it to another person who becomes extremely sick as a result. So, isn't it important that every single person, including the children, are vaccinated? But it seems there is nothing for them at the moment.
I mean, luckily, this virus is not killing kids. Imagine that. The world would have been on fire if these many kids, like adults, would have died.
Yeah.
Luckily, yes, it is causing complications. In a very small number of kids, it is causing nerve related complications, but it's not killing kids like adults. And thank God for that.
Mm, absolutely.
But I don't know,
Absolutely.
once it evolves, it probably might affect children. As far as the vaccination of the kids is concerned, I get this question all the time from my friends and family, be it pregnant ladies or lactating mothers or kids. Why are these people not getting vaccinated? It's just that because we haven't done a study on them yet. We haven't tried the vaccine on pregnant ladies or lactating mothers or children. We are still in the early stage. If this virus continues to be the way it is, there will be vaccine produced for every single person, every single group of the population.
Yeah, but I do feel sorry for pregnant women because I have read about so many pregnant women dying of COVID and were not eligible for a vaccine because of their pregnancy, and then not one but two losses there, and purely because not enough research was done. But that is still not as bad as what is happening right now in India. But thank you very much, Dr. Saab. If you would like to say anything before you go, please go ahead. And I wish you all the very best for your work in India. And please stay connected and see, if we can kind of, I don't know if you can tell me if anyone is looking for a few an extra pair of hands. I would be very happy to be there or be any kind of help that I could be.
I mean, firstly, a big thanks to you, Poonam. If I'm going on Tuesday to Bangalore catching a Air India flight, it's because of your big help of getting me the visa so quickly. Because I thought of that, of going to India a couple of days back, and I'm already here packing my bags. So thank you very much. I might call you up again if I have any problems with the embassy there in Bangalore. Hope not. And message to your followers. I'm a very small man. What message will I give? I'll tell you the same thing what I tell my family and friends.
Yeah.
I, when things were starting to get bad, I told this to my family and friends. I said, do not talk to me or do not stay in touch with me if you're not having vaccine. I'll only
Wow.
talk to you if you have vaccine. Get the vaccine and make sure you everyone around you gets the vaccine. If you have any questions, I'm happy to answer about the vaccine, but do not come up with excuse for not having a vaccine. If you can make a WhatsApp group or a networking group to go to Goa for a wedding or for a friendship party, you can do the same for having a vaccine. Make a network. If you want it in India, you can buy anything you want, or you can get anything you want. Networking is everything in Bangalore. So use your network, get the vaccine, save your life, save your family's lives.
That's awesome. Thank you very, very much, and wish you all the best. Thank you for being with us.
Thank
Your
you, Poonam.
advice, your information is so valuable, and I'm sure thousands of us are going to, make good use of that and probably spread it among our friends and families across the world. Thanks.
Thank you, Poonam. You have a nice evening. Speak to you
And you.
soon. Bye bye.
Bye bye.